A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Hi, this is Teresa Duncan of Odyssey Management and the host of the Nobody Told Me That podcast. I'm here to talk to you about Code 4341 and Code 4342, which are our scaling and route planning codes. As someone who speaks around the country on insurance, I get questions on perio codes all the time, and I do believe this, along with crown buildups, are the most problematic codes that I hear of. Sounds like there's a lot of people having issues getting them paid more and more. Now, the requirements for clinically doing 43, 41, and 42 are set in your office by, coming up with a good periodontal guideline. But really, the premise of scaling and route planning has not changed. What has changed is the insurance company the carriers are processing the claims a lot more, I would say, strictly than they used to before. They have changed the requirements for benefits and are actually asking for a lot more documentation than they used to. If your front office is coming to you and saying, I'm having a lot of problems getting this paid, or I'm going to need more documentation, they are absolutely not alone. This is what I'm hearing across the country. What we need to have in order to submit these claims and get them paid are 2 requirements, and 3 if you've got some good camera skills. But the first one is radiographs. So a good full set of radiographs is essential, even if you're doing 43, 42, as complete of a set as possible. But here's the kicker. It needs to be current, meaning within 24 months. Most insurance contracts won't pay out any benefits if the radiographs are older than 24 months. And so even if we've got x-rays, 3 years ago and they're gorgeous, it doesn't matter. Contractually, they just can't pay out the benefits. The second piece of information that you'll need is a periodontal chart, a complete periodontal chart. That means probing depths, that means clinical attachment loss, that means pus, separation, furcations, all of the things that you've learned in hygiene school. When I put a complete perio charting up on the screen, I often hear from many administrative team members that they don't have as many colors on their charts as what is up on the screen. And that is actually what we need. Is the insurance company is going to request a complete perio charting. And if we only have probing depths, then that's not enough. If we have only probing depths plus bleeding points, that's still not enough. We need clinical attachment loss and we need bleeding points. So if I can get that from you, I'm going to be able to get my claims paid most of the time. Why do I say most of the time? Well, because some plans have moved to 4 to 5 millimeters of clinical attachment loss in order to pay the claim. And so I've seen a couple carriers go to 6 millimeters, and that's really, that's a lot. And you and I both know that's a lot. So as complete as possible is what we're looking for. The third piece of information is, and I don't know if you have this or not, but if you've got intraoral images, they're wonderful to submit. Now the trick is what is a good intraoral image of a smile going to do for you? Well, nothing much. So what I advise is after you do your probing and you've got some really, and let's admit it, the patient's probably got bleeding spots and you can see it. That's where I would want you to take these intraoral images and send those in. Not only are they good for the carrier, but they're also good for patient education. When you get the patient to come back and they are, they've improved, and you can say, hey, look at the difference between this, a year ago and today. Keep up the good work and all of that. So those 3 items, the radiographs, the complete periodontal charting, and the intraoral images, are what I can use in order to get my scaling and route plannings paid if the carrier doesn't have an overly restrictive plan, like a 6 or 7 millimeter requirement. I don't see where 6 is as much as it's gone, but that's pretty high. The question I always get about 4341 is, what about 4 quads in one day? Well, contractually, it's almost always disallowed. However, if there are extenuating circumstances, ask your administrative person to file an appeal. If there are reasons that 4 quads in one day is good for the patient, then you can show this via your documentation. Examples of this would be perhaps maybe their immune system is compromised and they're not able to come in, or it's not healthy for them to come in often. What about the patient who is morbidly obese or is a senior and isn't able to get around a lot? What about that kind of person? They need help, right? So in that situation, seeing the patient come in only once is probably healthier for them. And that is that would be a good denial reason. I would send that in and see if I can get that appealed. Also, if they're taking any medication that causes them to bleed a lot, so those, if they need to stop their medication, it's not healthy for them, so it makes sense for them to come in once so they don't have to stop their medication often. Those would be good reasons to appeal a denial of 4 quads in one day. If you're unsure, though, always ask your administrative person to send in what we call a pretreatment estimate to the insurance company. It does take about 3 to 4 weeks, sometimes sooner, but about 3 to 4 weeks. And they will have to follow up. Often the pretreatment estimates, the determinations are sent to the patient and maybe not always us. So make sure that your administrative person knows to follow up on that. Well, those are my tips regarding 4341. I hope that they have been helpful, and you can always find me online at odysseymgmt.com. My company is Odyssey Management, odysseymgmt.com. And if you go over to the webinar page, I have a whole hour of hygiene codes, and I go over all of the perio codes that a hygienist would use, and it was actually given for you all. So I hope that you find that helpful, and I do have a book on insurance conversations if you're up for that. But take a look at the website. There's lots of free webinars for you, and happy coding. Thank you.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienists.com and subscribe to our newsletter. You can also email us at ataleoftwohygienists@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.